So we are back with you now on Wave Listens Live, an important segment to get to now with Cornerstone Wellness as we bring you back here into our studio, and Dr. Doug Kane joining us as always, and it's great to see you as well.
Nice to be back.
We were talking in the break there that the holidays is what everybody's focused on right now, and so you're either going to be seeing loved ones that maybe you haven't seen in a year, or you are hoping that they're going to come to these family functions, but if they're suffering with certain conditions, as neuropathy being one of them, it may be difficult.
Yeah, it is. It is. It can be a very difficult time of the year. You know, the holidays is a happy, joyous time for most families, and you know, sometimes not everybody. But then, you know, there'll be a certain amount of families that we know this year. This is going to be the first time. You know, there's going to be an empty table setting where, you know, there's somebody that should have been. You know, somebody that's passed on throughout the year, and you know that really hurts. But when it comes with neuropathy patients, a lot of times, where they're most comfortable is usually in their chair or their bed at their house, and they don't feel like getting out. It's difficult for them. You know, the amount of walking, getting in and out of a car, traversing stairs in someone's house. Let's say there's going to be little kids and toys on the floor, or maybe pets. So there's balance issues, fall issues. So it's a big concern for people. And so sometimes these people will either elect to not go visit families throughout the holidays, or in some cases may not even be invited because of their infirmity, and that's sad. That's kind of the beginning of, in another way, kind of the long goodbye. You know, that's a phrase we usually reserve for things like Alzheimer's, but when we look at neuropathy, it's classified the same way. It's a progressive degenerative neurological condition if you don't do anything, and you know, that's why I keep coming here on Listens, is so people understand it doesn't have to be that way anymore. There is help. We can help reverse your neuropathy so you can enjoy your family through the holidays.
You talked a bit about some of the things that are difficult for those who are suffering with neuropathy. You mentioned balance and comfortability being a huge one. So what would be some of the symptoms for somebody who has, maybe this is the first year that they've started to feel this way?
Great. Yeah, excellent question, because a lot of times patients will come to us, they've not been diagnosed by any other healthcare professional. You know, maybe they've heard this segment. One of the things that we hear the most is, it started out feeling like there was a wrinkle in my sock. Or sometimes maybe a pebble in the shoe. Other times they will just notice issues with their feet, and they just feel like as soon as they get out of bed, they've got to have feet on, or have shoes on their feet, because walking barefoot is uncomfortable. They'll experience a lot of pain. They'll experience numbness, or there'll be temperature issues. Either they'll feel like their feet are on fire or frozen solid to the point that those cause pain. Some people feel like you know, electric shock or tingling. Some people describe it as feeling like there's ants crawling on their feet. So, you know, these are the ways that people can be affected physically in terms of the symptoms and how that affects them on a day-to-day level.
How does this come about? I know there are several main causes for it that send people maybe down this road.
Yeah, well, the simple answer is peripheral neuropathy. It can affect any nerve in your body for a various number of reasons. Typically what we deal with is hands and feet, usually the feet, because it's the farthest away from your heart. The heart's the pump, it's what circulates the blood, it's about oxygen and nutrients to those cells, and so that's what we typically deal with in our office the most. At the end of the day, neuropathy is an effect of the nerves because they're not getting that oxygen and nutrients, and some practitioners will speak in terms of the nerves are dying. That's really not the case, is what science shows us. They're actually becoming dormant to help save themselves. It's kind of like, you know, when we go through a hot stretch and not much rain, what happens to our lawn? Okay, yeah, it turns brown, it looks dead, but it's not. It's actually gone dormant to save itself. It gets the right set of circumstances, in this case, rain and cooler weather, and it comes back, it greens up, it thrives. And that's exactly what we do in treating neuropathy. Is we bring about the set of circumstances where we're increasing oxygen, increasing nutrients to those nerves so they can regenerate and grow and heal and function properly.
That was going to be my next question, because you mentioned when we were talking about people missing out, especially during the holidays when you might feel it the most, that it doesn't have to be that way. So if folks call you and say, okay, I don't want it to be that way, what are some of the things, depending on their their individual case that can be done to help.
Okay, so we start off with a thorough exam, okay, and it's important to notice that the exam's painless because a lot of people have had what's called a needle EMG. Those are not fun. I've had one of those myself from a different injury, but yeah, it's completely painless. We get a baseline to understand how well or how improperly your nerves are working. That gives us our baseline, and then we can go from there. Now, it's not a one-size-fits-all. It's very customized to each individual. There's many different causes. It can be diabetes, it can be chemotherapy, it can be chemical exposure. There's over 100 different causes. So we tailor that according to, what their problem is. There's also a metabolic aspect of it as well. Neuropathy is actually a whole body problem. It's usually just the ends of the extremities, the feet and the hands, where we see the symptoms first. But we also have to do that. We want to make sure that a person has the greatest healing potential they possibly can. If they have some orthopedic related issues with their lower back, we can do lumbar decompression in office. The soft wave device that we've had on here on Listens before, that has been a game changer for people. It can really accelerate the results. We tell patients that you are definitely going to see the change in the first 90 days, and once we've added soft wave, we're seeing those changes within the first 2 to 3 weeks.
Wow.
So yeah, it's been a big accelerator of getting some positive results quickly.
2025 can be a whole new year. Okay, best way to get in touch with you and anything else you want people to know before we leave today?
Call the phone number on the screen right now. My staff is standing by to take your phone calls. We can get you in this week so that by the time that 90 days away, Valentine's Day. By the time Valentine's Day gets here, it'll be a whole different quality of life. You can enjoy time with your family. You can feel good about going on vacation and having less pain and better balance.
Just think the month after Valentine's Day, the good weather's back, and you really want to be able to walk and get outside if you can.
Enjoy your spring.
Good to see you. Happy Thanksgiving.
Thank you very much.
We're looking at the staff here with you.
My wonderful staff. Amazing people.
All right, so stay with us here on Wave Listens Live because we still have one more great segment to go. Coming up next, we will have Windows Direct USA here talking all about getting your old windows replaced in time for the winter months. They also brought a special for our viewers. We've got the details for you coming up next.
No matter how loud the thunder,